The pelvis should be balanced so that the anterior superior iliac spine and the posterior inferior iliac spine are in the same plane. The pelvis can rotate anteriorly or posteriorly. It can rotate bilaterally or only on one side. The pelvis can also inflare, where the ilium moves toward the midline, or outflare, where the ilium moves away from the midline. The following procedure to correct imbalances in the pelvis utilize indirect functional technique. Begin by assessing for the position of the anterior iliac spine. The first demonstration represents a posterior rotation. The pelvis is further rotated into posterior rotation following the direction of ease, and then stretched to rotate it into anterior rotation. After the procedure is performed, the area is reassessed. If the pelvis is anteriorly rotated, then the leg is positioned again in the direction of ease to further anteriorly rotate the pelvis. The leg is then moved back and forth between anterior and posterior rotation positions. At the end of the movements, the area is stretched to move it back into a balanced alignment. If the pelvis is inflared, the leg is positioned to increase the inflare. Then the leg is moved back and forth between the inflare and outflare position. At the end of the movements, the area is stretched in the outflare position to balance the pelvis. If the pelvis is outflared, the leg is positioned to increase the distortion, then moved back and forth between the inflare and outflare positions. The area is then stretched in the inflare position to restore balance to the pelvis. To complete the procedures for balancing the pelvis, the symphysis pubis should be balanced. This is accomplished by having the client push their knees together against resistance.